Facts about the coronavirus. The only article you'll ever need about COVID-19. There is a lot of fear and confusion surrounding the coronavirus called COVID-19. And it doesn't help that some elements of the media have been firing off information many consider fear-mongering. Even a recent Listverse article could be considered as such. But fear is the last thing anyone wants to spread, since even a global pandemic doesn't mean it's the end of the world as we know it. The information on the virus is limited at the moment, as there will need to be a great deal of study before it is fully understood. In the meantime, information is power. So this list contains 10 things you should know about COVID-19 and how best to protect yourself from misconceptions, misunderstandings, and outright media lies about it. This information is just the tip of the iceberg, so keep up to date on outbreaks in your area from official sources, and everything should be fine. 10. What is a coronavirus? COVID-19 is a coronavirus, which means very little to most people who don't work in virology or immunology. A coronavirus is a group of viruses that can infect mammals and birds. In humans, they can cause respiratory tract infections, many of which can be treated with over-the-counter medication. The so-called common cold is the result of a coronavirus. And while most are well understood and rarely more than an inconvenience, some can be lethal. COVID-19 refers to the outbreak of the disease, which is broken down as coronavirus disease 2019. The virus itself also has a name, but it's a bit of a mouthful: severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2. Part of that acronym may be familiar, seeing as the world already went through a similar outbreak of SARS in 2003. The viruses are related, and it wouldn't be out of the question to call this new outbreak SARS 2.0, though you likely won't hear any professional virologists say that in the media. Regardless, COVID-19 is a coronavirus, and it is spreading, but that's not a cause for alarm. Rather, it's a cause to prepare and protect ourselves in much the same way we do when it's cold and flu season. 9. Where COVID-19 originated. It's well known that the virus was first seen in Wuhan, China, but it's not fully understood exactly where it originated. COVID-19 is likely a zoonotic virus, which means it can be transmitted between animals and people. This has led researchers to look for animals that might have originally carried the disease. There are a lot of similarities between COVID-19 and two bat-derived strains of beta coronavirus, which means they are likely related, because the viruses share about 96% of the same genes. It was initially believed that bats were the source of the outbreak, which was pinpointed to the Wuhan seafood market, where exotic animals are sold. As time went on, and more research was conducted, Chinese researchers were able to determine that COVID-19 shared 99% of the same genetic information as a similar virus that infects pangolins. This suggested that pangolins may have been an intermediary host for the virus, but the research wasn't officially published, and much of the analysis remains unconfirmed. While determining the precise origin might help virologists better understand COVID-19, doing so isn't entirely necessary in combating the spread of the disease, now that it's been released into the human population. 8. How COVID-19 is transmitted. Since the first day the world learned about the Wuhan coronavirus, the fear of it spreading began to rise. How was it transmitted? And what could be done to limit its transmission? People have always feared Ebola, but that's far harder to catch than something like a coronavirus. And it's all about what it infects and how it is transmitted. COVID-19 causes a respiratory infection, and it's through a person's respiration that it spreads the easiest. There are two known means by which the virus spreads: person to person and through contact with infected surfaces. In a person-to-person situation, the virus can be spread through close contact, which is generally considered to be a distance of 6 feet. The way a person can pass it on is through respiratory droplets, which are produced when a person coughs or sneezes. Covering one's mouth when this happens helps alleviate the spread of the disease, and infected people should wear a face mask to reduce the risk of transmitting it to someone else. But please heed the Surgeon General's warning: 6 and don't buy a mask unless you need one. The other way it is spread is through a surface contaminated with the virus. A countertop could have been in the pathway of a sneeze which carried COVID-19 to its surface. Touching that, and then touching your mouth, nose, and possibly the eyes can result in infection. 7. How COVID-19 is detected or confirmed. One of the biggest issues with detecting COVID-19 in a patient is that it presents much like the common cold. To combat this, researchers across the globe have been scrambling to come up with a way to test for the presence of the virus, and this has resulted in several different testing methods. One of the best ways to check for the virus isn't to see if you can find the virus in a person's body, it's to find the antibodies the body produces to fight the infection. The tests that look for antibodies are called serological tests, and a firm in Singapore may have perfected a means of conducting this type of test to find COVID-19. Antibody tests are probably the fastest and easiest way of detecting the presence of COVID-19. But it isn't the only way. There are tests currently being used around the world, which look for the virus genetic information in a person's saliva, mouth, nose, and anus. These tests use the polymerase chain reaction (PCR) method, which is a process in molecular biology that rapidly produces billions of copies of DNA for study. While these tests can detect the presence of COVID-19, they cannot identify people who were infected and ultimately cleared of it. 6. Who is at risk? There is no known immunity to COVID-19, which means that everyone is at risk of catching and spreading the infection. That doesn't mean this is a perfect time to panic. Just because you might become infected, doesn't mean you're going to fall over dead in a few hours. COVID-19 can be dangerous, but like most infections, certain portions of the population are more at risk than others. Young children, healthcare professionals, the elderly, and people with a compromised immune system are the ones who are most at risk of becoming seriously ill from COVID-19 when a healthy adult contracts the virus. There's a possibility that they will not show any symptoms at all, and won't get sick. This is one of the reasons the virus has managed to escape the confines of Wuhan, China, to infect the world. Infected people who are asymptomatic become unknown carriers, and even when an otherwise healthy adult does show symptoms, they are often mild and comparative to the common cold. 5. What are the symptoms of COVID-19? The initial segment of this square is going to list the indications related with COVID-19 that shouldn't startle anybody. However, the last piece will be about the more hazardous parts of the sickness. Try not to be frightened, as these are the most pessimistic scenario. Side effects that won't influence the vast majority are tainted. The most widely recognized indications of COVID-19 are fever, hacking, and brevity of breath. These are similar side effects the vast majority get from the normal cold. Yet they are the mildest potential side effects an individual can experience. For the individuals who are under a more noteworthy arrangement of hazard because of an undermined invulnerable framework, or meet the criteria recently referenced, manifestations can become undeniably increasingly extreme. COVID-19 can build the odds of contracting pneumonia, it can cause numerous organ disappointment, and at times, it can result in death. These are the most serious cases. However, all are of worry because of the straightforwardness by which it very well may be transmitted from individual to individual. For COVID-19 mortality concerns, truly, COVID-19 can take an individual's life. However, that doesn't mean the world will wind up as it did in Stephen King's The Stand. The death rate for COVID-19 is assessed to be 2.3%, and keeping in mind that that number may appear to be low, it's definitely not. In the event that you analyze the death pace of COVID-19 to something increasingly basic like this season's flu virus, it's significantly higher. Influenza has a death pace of 0.1%, which sees a normal of 1 passing for every 1,000 people. These numbers are resolved by means of the case casualty rate, CFR, which thinks about the all-out number of contaminated patients with the individuals who capitulated from the disease, while COVID-19 is a lot higher than the flu. It presents as a gentle contamination in by far most of individuals who have had it. Most of individuals who have passed on in China have been old, and investigations of passings from the infection show that the CFR bounces to 14.8% for individuals who are 80 and more seasoned, while those between the ages of 70 and 79 have a CFR of 8%. For individuals who were at that point basically sick when they interacted with the infection, that number bounces to 49%, proposing they are the most defenseless individuals from the population. 3. Avoid becoming infected. List first distributed an article on top 10 things you need to do to prepare for the coronavirus. However, this was expected to be a greater amount of an apocalypse-type situation. So think about it while taking other factors into consideration, of which there is a lot to be found in the remarks on that rundown. As a general rule, there are steps you can take to abstain from getting tainted, and risks are, you've been doing them from the beginning. Since COVID-19 is a coronavirus, which is passed similarly as a typical cold, the most ideal approach to shield from getting it is to wash your hands with cleanser and warm water. Abstain from contacting your face in the wake of coming into contact with anything generally utilized like door handles, and in the event that you need to head outside, attempt to maintain a strategic distance from wiped-out people. Odds are, you do the entirety of that as of now, so you don't need to let COVID-19 overturn your life or your everyday practice. In the event that you have worries about ending up in a spot with a ton of conceivably contaminated individuals, you can abstain from venturing out and going to occasions with swarms. Yet that may not be important. On the off chance that it causes you to feel better to wear a face veil, you can do as such, however ensure you get the correct kind. The U.S. Food and Drug Administration perceives 4 off-the-rack N95 respirators, which might be compelling in halting the spread of COVID-19. 3M particulate respirator 8670F. 3M particulate respirator 8612F, Pasteur F550G respirator, and the Pasteur A520G respirator. These respirators are not reasonable for youngsters or men with facial hair. So it's time to bid farewell to that unexpected fashionable person beard. 2. COVID-19, HIV, and other conspiracy theories. One reason there are such a large number of fear-inspired notions about infections like COVID-19 is that a couple of individuals genuinely get it. Ideally, this rundown will help with that, yet there are individuals who hear a remark like, this infection may utilize the pressing systems of different infections, for example, HIV, and their minds will in general run wild. That finding was distributed by researchers at Nankai University, and it's valid. The infection has a HIV-like change. However, that doesn't mean somebody weaponized a type of HIV in a lab someplace and discharged it upon the world, as some paranoid fears have expressed. These equivalent components show up in numerous illnesses as the after effect of normal mutations. That comment has an inseparable tie to the methods for battling the spread of contamination. And research like this assists push with promoting research, which could ideally prompt a fix or immunization. You may have seen other fear-inspired notions, including one about another 5G remote foundation being the reason for the infection, yet this is so absurdly bogus, it scarcely merits mention. The most significant activity with regards to hearing these accounts is, inquire as to whether they bode well, check whether they are distributed by trustworthy sources, and adopt a sound judgment strategy to anything you hear. 1. What to do if you think you're infected with COVID-19. The absolute first thing you have to do is recollect the words imprinted on the front of the Hitchhiker's Guide to the Galaxy, which are, "Don't panic. Panicking doesn't support you or your friends and family. So you have to deal with yourself to guarantee you don't spread the contamination and ensure you get the best possible consideration. On the off chance that you build up a fever alongside manifestations of respiratory disease, you should call your medicinal services supplier and request their recommendation. They will realize the correct inquiries to pose to help decide whether you have the normal cold, or on the off chance that you have something more serious. If you dread you genuinely came in contact with somebody contaminated with COVID-19 and are concerned you may have it also, you have to get tried. Since you are going out to get checked, be mindful, and keep your mouth and nose secured. This will shield you from passing the infection to others. So in the event that you have a respirator or careful veil you can utilize, do as such. If not, you can utilize a scarf or comparable piece of clothing. Your nearby medical clinic may not yet be outfitted with testing packs for COVID-19, so call your neighborhood general well-being division for data on the best spot to go.